Okay, so welcome everyone. Thank you for being here. Today we are doing our Q&A question and answer panel with our medical students. We have a few medical students that are going to be answering questions. I guess to keep this orderly, I will call on people by name and allow them to introduce themselves because things can get real awkward on Zoom. So why don't we start with Vincent Bargnes. You guys can give a little introduction about your background, who you are, your journey and stuff. And I guess maybe anything that you might be able to answer questions particularly about before we open up for questions. And Vince, please correct me if I pronounce your last name incorrectly. Sorry.
Great job, Ben. Hi, everybody. Again, my name is Vince. Call me Vince, Vincent, whatever you like. I'm born and raised in Buffalo. I went to undergrad at Canisius College for biology. Then took a year off doing clinical research in neurology. Then joined back in academia at UB Med. And I'm currently in my third year of med school now. Interested in neurology. So if we can talk more about that, talk more about gap years too, I'd be happy to be a resource. And go Bills, of course, to begin this.
Awesome. Sorry, I'm trying to figure out how to unmute myself. Megan, would you like to go ahead?
Sure. So I am Megan Conroe Graham. I'm an MD PhD student. I'm actually in the same lab as Ben, which is how he recruited me to talk tonight. So I am in the fourth year of my program, which is normally a 7 to 9 year program overall. So I'm about halfway through, and I'm happy to talk more about what would make you choose an MD PhD program, what the good things and the bad things are about it. So if anyone has questions about that, please feel free to ask. But I can also talk about the MD side as well.
And Mr. Bobby Finley, soon to be Dr. Bobby Finley.
Couple of years. My name is Bobby Finley. Grew up in Buffalo and East Amherst. I went to UVA for undergrad doing biomedical engineering. UVA, that's the school that we've been the defending basketball champs for the past 2 years. Just wanted to throw that out there. Go Hoos. I then went to Baltimore where I worked at a company called PC Test, where I was an engineer, basically testing cell phones, seeing if they're safe, hearing aid compatibility, a whole bunch of random stuff like that. Then I went to medical school, and I'm currently a third year medical student who does not know what kind of doctor they want to be yet, but still working on it.
Okay, and Jenna, would you like to go ahead?
Hi, everyone. My name is Jenna Betz. I'm a third year medical student at UB, and I'm originally from California. So if you have any questions about moving across the country or, going where you don't have a lot of family, I'm happy to speak to anyone about that. I went to UCLA, and I'm a biology major with a focus in evolution. And then I took a year off and I worked at a spa for about a year, which was really, really fun. So yeah, I grew up in Northern California, kind of a smaller town, and I love being in Buffalo. And it's nice to meet all of you.
Okay, great. Sorry, I just started choking really bad when I was about to try to introduce Jenna. I don't know if everyone could tell or not. Okay, so I have questions that I think would be useful for students to know the answers to, but let me first ask anyone here I'm sure if you're here, you probably have some sort of question that you're curious to ask. Now is your time. You can send it in the chat. You can send it, you could speak it aloud. I'll give a moment for anyone to do so.
Hello, I just wanted to hop on and say hello to some familiar faces. First and foremost, hey Vince, hey Bobby. I think, at one point we might have been on a school bus together, or definitely in a chorus. But I am working on the mentorship portion of Ask and wanted to just show some support. It looks like we have some really good questions coming up in the chat so far. So why don't we give some more attention to those? But welcome, and we're so happy to have you.
Let's see. So there's a few questions. Why don't we start with the question for Vincent, because it'll be the shortest answer. Vincent, what did you do for your clinical in neurology, and what was it like every day? I'm also curious.
Yeah, awesome. So in between my undergrad and med school gap year there, I did research over at Dent Neurology. So Dent Neurologic Institute's actually one of the largest outpatient neurologic centers in the state, possibly country. And it's right in the backyard here in Buffalo. And our research there was mostly on retrospective research of chronic migraines. And also the role of cannabis, medical cannabis, in the chronic migraine management, also in post-concussive headache syndrome as well. And in terms of what it was like every day, it was a full-time position. Maybe it started as part-time, but I think it was full-time. Yeah, pretty much as full-time. And Monday through Friday, kind of a deal. And a lot of just going through charts, a lot of chatting with the PIs and the research team there. To get a better feel for what headache medicine is like. That was the bulk of the research, and just had a lot of fun doing it. I think it really opened my eyes to neurology, what clinical neurology looks like. Right around the same time as I was there, the first class of medications specifically designed for migraine were coming out. So it was kind of cool to be in this institute that was launching this brand new class of medications in 2018. So hope that answered your question.
I'm just going to let you guys go ahead and just pick up questions from the chat and just run with it rather than mediating.
Okay, I guess I can answer some of the questions that are kind of along the same lines. What made you decide to pursue an MD, and when did you know med school was right for you? So I think that many people might face this decision of whether to go to med school or possibly to go into another health profession, or if you're more inclined towards science, you might consider whether to get a PhD or something like that. So I think that one of the best ways to figure out whether med school specifically is right for you is to get in touch with doctors and to do shadowing as much as you can. I know it can be very hard as an undergrad to know who to reach out to and to find shadowing opportunities in your area, especially now with COVID. But if you can try to ask around in your network and finding people who would be willing to talk to you about their experiences, that's really helpful. And then just asking yourself if that kind of patient contact is what you want to do every day. There's a lot of videos out there about like day in the life of a doctor. For me, I kind of knew that I wanted to do an MD when, like I said, I was shadowing and I was also doing some research, and I absolutely loved the research, but I knew that I also needed that patient-centered approach to really feel fulfilled in what I was doing. And I hear that from a lot of people who decide to choose an MD. It's not for everyone, but if you really feel like you want to be directly involved in patient care and you really like talking about people's health issues, then that could be a sign that that's something that would be right for you. And also if you're willing to put in a lot of work, because it is a lot of work, and people always say, if you just want to make money, don't go into medicine, go into business. But it is rewarding, I think, for most of the physicians that I've talked to, if that's something you're passionate about.
I'll echo that too. I think there's a lot of great ways to gain that exposure in the healthcare field, and chatting with doctors, shadowing. I was an EMT as well, kind of got that EMT exposure of a little bit of training, and then also some one-on-one time with patients, working in clinics, things like that, really solidify your role. Because like Megan so accurately said, you're dedicating the rest of your life at a younger age, and it's definitely good to know exactly feel out, not exactly, but feel out the field, feel out how things work, what their day-to-day life is. So absolutely, 100%. And then I'll dig in the next question here. When did you know what that med school was right for you too? I'm not sure. Also, I know there's interview seasons going on now. when you get to interview season, and if you're lucky enough to have multiple acceptances, definitely going and asking what the program is like. Some med schools, I'm not even sure how this is going during COVID, but have kind of like second look days into how their schools run and what their classes like, stuff like that. So it's also something to consider too.
Yeah, I guess I wanted to say kind of like, as far as, like I guess kind of how I made the decision was, I wasn't sure if I wanted to do medicine or engineering. And I was getting kind of to the end of my like engineering degree. As in my last year. And medicine had always kind of been on the table. And one of the kind of important things that I ended up doing was I ended up doing some volunteering and some shadowing. I think a lot of students definitely come in with like however many 100 hours of volunteering and shadowing. And yeah, I didn't do anything really all that crazy. Like I think I may have had 20 or 30 hours of volunteer work and maybe like 2 days of shadowing. But I mean, really at the end of the day, kind of the purpose of that is to figure out, is this something that I actually want to do? Could I see myself doing this? And I mean, I'd say like, as far as, kind of getting those opportunities, when I signed up for volunteering, I remember it was maybe like March, my senior year of college. And, I thought I like went online to the like university health, whatever. And they were like, oh yeah, all the, positions, like you had to sign up by like October to be in the system. And, I pretty much just emailed the person that was in charge of coordinating volunteer stuff and said, hey, like, thinking of going into medicine. If you need me, I'd love to do something. If you can find a space for me, like, please. If not, then whatever, I missed my chance here. And she got back to me and she was like, oh yeah, come on in. Like, there's a couple things we can have you do. And, they're always looking for volunteers. So, I mean, as far as like kind of any of those things go, if you, email the people who are kind of in charge of different things and say like, hey, I'm interested, put me where you need me. Don't be too worried about, you can still do that kind of stuff. And it's really, you really just got to send, an email or make a phone call, and try to do that kind of stuff. And then like, I guess just kind of following along with that path, I wasn't sure if I wanted to be an engineer or a doctor, and I went into engineering. That was, I got a job after college as an engineer, and within like 2 or 3 months I was like, all right, this is nice, I could make a career out of this. But I liked what I was doing in the hospital better. I liked being with patients, I liked being with their families, and I saw a couple surgeries, I liked that better. And that's kind of how I kind of finalized my decision, was like, okay, that's for me. Like, I want to be with the people, I don't want to be in this, background room doing this kind of stuff. So if you just kind of give yourself options, I think it helps. And just seeing kind of what is out there, so that, really whatever choices you make in life, if you realize you made the wrong choice, you can, say, okay, well, I like that better, I'd like to do that.
That's a great lesson. Thank you, Bobby. By the way, I also just want to point out, while the questions are coming in the chat, there are also answers coming in the chat. So keep your eyes peeled. Some of the panelists are also responding there. We got a question. So Vince, are you in neuro? Are you interested in neurology?
Yeah. So sorry, I was actually just typing it to Ahmed, but
Oh, sorry.
no, that's okay. We can say it loud. So I'm definitely interested in neuro. I think what got me hooked onto neuro was doing the research in it prior to med school. Headache medicine in general, it was a great team that I worked with. They were super supportive, exposure into the field, and a lot of the research that we did was with chronic conditions like the chronic migraine and the chronic post-concussive syndrome. And there's some excellent drugs and therapies coming out now that are really changing people's lives. And I think between the the before and after of those treatments that we're seeing, and just the population. And again, the team that I was with, I think it was a huge factor and influenced my decision to at least pursue neuro.
Really can't blame you.
Yeah.
Something about neuroscience research, just
Ben's a little biased there, but to touch on another one, I think we can dovetail. Someone asked about, do you change your who was that here? Oh wow, this chat is exploding. Was there some comment about?
Oh, I found it. I can read it for you. Have your interests changed since you started? I heard it's not uncommon to end up in a different specialty from what you thought you might be doing.
Yeah, so I think that Jenna, Bobby, and I are all in our third year, so we basically have only done one semester of the 4 semesters in the clinical aspects of medical school. So who knows, maybe we'll be exposed to something in the future and totally change it, our perspectives on that.
A really great overall question. Do you have any advice for interviewing? I think med school interviews are maybe notoriously scary and intimidating. So any advice? I'm sure a lot of the people here are going to be interested, or eventually will it be in the med school interview? So what can you share for them?
I spoke on it briefly in the chat. So anyone else, please, I just said basically practice. Leave yourself plenty of time to arrive. You don't want to be flustered on your first morning, and be yourself. So that's really what I could think of. If anyone else has any other tips, please speak on it.
Yeah, I'd echo what Jenna said. I walked in like 3 minutes late my first day because I spent like 20 minutes trying to find parking. And that was a little scary for the interview. I thought they were just gonna like cut me right then and there. But and then the other thing, she said kind of stay true to yourself. I think as far as like interviewing and stuff is concerned, you really know the things you like, know the things that you love to do. And, a lot of the times when people ask me about stuff, be like, oh, well, I played hockey and this, and I love doing this. And, in college, I was part of the circus for a semester, and, I went in and this is my hard work and blah, blah, blah. And I mean, just always try to bring it back to the things that you actually really enjoy and the things that you really enjoy talking about. Because if you kind of try to, force yourself to talk about what you think the interviewer wants to hear, I think you're kind of setting yourself up for failure a little bit, because it kind of comes off as, you grasping for straws or something. Where if you're talking about a topic that you really enjoy, the interviewer hears that and they say, oh, wow, okay, so this person's passionate about these things. This person's interesting. They like doing this. So yeah, I would just kind of stick to your guns and try to be yourself and talk about what you really like talking about.
Along the same lines as Bobby there, also once you receive the interview, it's a huge step forward. Trust that the process that you put yourself through is yielded this huge opportunity. So have some confidence in yourself that you got that far. And along those same lines, know your resume, know your CV, your application inside and out, because the school that picked you for an interview is really looking forward to hearing more about what you bring as a med student to them. So definitely a lot of great interviewing tips, and maybe we can do something in the future. I can talk privately with somebody, but interviewing is really an awesome opportunity to have and to really to make the best of.
If you all were interested in contributing, written interviewing tips, we could even have a sort of a sheet that we could send out to people. Like, here are a list of tips from those who have been through interviews and made it into med school successfully. I think that would be very useful. We got a question from Julia. She also sent this through the Instagram. Do international students get to go to medical school in the United States? I know it's pretty hard, especially for someone from another country. Just wondering if international students do that.
I just I sent a message to that question in the chat. So to my understanding, it's possible, but it can be difficult. Private, but public schools like ours in Buffalo, unless you're a citizen or possibly a green card holder.
is Megan's connection breaking up for everyone? Is it just me?
No, it's
Everyone? Okay. Megan, I'm very sorry to share that much of that was interrupted by technical issues. I'm not even sure if you can hear me.
I just want to point out a Mad's question asking about just choosing a major in undergrad. Since Bobby, it sounded like you said you went from engineering back to medicine. I don't know what your undergrad major was, but if you guys have a pretty good idea in undergrad of what you wanted your major to be, and how, what was your process in selecting that major?
Did you just say like as far as like choosing a major?
Yeah, Ahmed asked about just getting ready for, let's say, just deciding major for a major for undergrad.
Yeah. Well, I think there's a couple things you want to look at. I know a lot of students decide to do like a biology major. And the reason that I didn't want to do a biology major was like a few different things. One, I was like, that doesn't sound interesting to me. Like I like an anatomy. I enjoyed biology, but to spend 4 years to me was like, I don't think I want to do that. So that was one. Two, I kind of figured, you know, everyone's gonna have a biology degree. Why should I kind of be like everyone else? I should do something different. And three, I was, going into college thinking, oh, I might want to do medicine. There's 4 years between the time I go into college and the time I come out of college. And by the time I come out of it, I don't know if I will want to do a medicine. So for me, it was really important to get a degree in something that, one, like I could get a job in, like I could get a job after college if I didn't go into medicine, and two, that I really enjoy doing. And I always really enjoyed engineering. So I kind of went in thinking, oh, I might just do any kind of engineering. And I think overall it really paid off for me. I know like my GPA was a little bit lower than, maybe if I took like a different major, but at the end of the day, in interviews, I'm like, hey, like I did this, I did engineering because I really liked engineering. Once again, like, don't put yourself in pain for 4 years doing a major you don't like. You should be looking at the things, oh, I really like doing this. And if it leads you to medicine, then that's great. Like that's where you should be. And if, it leads you to something that you really, really love doing that isn't medicine, then wow, you just found the thing that you really love doing. So I would advise towards, looking and choosing a major based on what you like and, at the end, what you might want to do as a job, even if you don't get into medicine. Because as I said, there's 4 years between the time you go in and the time you come out. So a lot changes.
Yeah, I would like to second that. Sorry about that. My internet cut out before, but just about like following what you're passionate about. Like medicine should not be your whole life. There's going to be other things that you're that you're really interested in, whether that's creative things or like engineering, for example, or like I said in the chat, when you're looking at volunteering, don't focus only on medical volunteering. Like there's so many things that you might be passionate about that you shouldn't say no to because you think that your entire resume has to be, oh, I was in a hospital and I was doing biology. What is important for you, both getting into med school and for actually being a good physician, is doing those things that are going to make you want to get up and go to class every day and go volunteer every week, and that make you connect with people in different ways. So don't feel like there's one path fits all for med school. And if you think you want to do it at the beginning and then you choose not to, that's fine. And for me, I had kind of the opposite experience. I went to college thinking I didn't want to go to med school, and then started falling in love with the clinical experiences that I was in as part of a summer research program. So yeah, like being open, like Bobby said, to whatever makes you really excited is the best advice I think I could give.
Oh. Just to follow up on Ahmed's question, I ended up choosing my my major after my first year. I was like in the engineering school, but I chose biomedical engineering after the first year. Maybe it helped a little bit. It kind of I'm kind of in the same situation now where, you know, the deadline's coming and you got to decide, oh, what do you want to do? What do you want to do? And I was like, all right, like I think that's the one. So I don't know. I just you know, I took a lot of classes that I thought were kind of useful for a broad variety of reasons, and I don't know, it paid off.
I have like an oddly specific question, but I'm studying forensic science in undergrad, and I kind of want to be like a pathologist, which is more like research based, but still requires like an MD. So do you think like getting more research will be better rather than like doctor shadowing in that specific case?
I think that because when you go into med school, I don't know if we touched on this before, when my internet wasn't working, but when you go into med school, you're not expected to specialize right away. And actually, if you're like too dead set on something, that can be kind of like, oh, you're not open-minded enough to how things could change. So because you do have to go down the MD path to be a pathologist, I would say both are nice. Like if you can do both clinical work and research, that's perfect. I mean, for anyone, if you can find both of those experiences, that's going to be amazing. But you still need definitely that clinical experience. If it's with a pathologist, then that's great, but it can really be with any kind of doctor. I think I've heard something like, I don't know, when I was applying, that my undergrad kind of threw out hours for us, something like 50 hours of shadowing is like a good thing to aim for, like 200 plus hours of volunteer work. I don't know if that's changed much, but that's one thing to think about.
Sasha, I couldn't quite hear the part. What did you want to do? What is your dream job?
To be like a forensic pathologist. So it's like much more like working in a lab, more like research stuff. And it still like requires an MD. So I was just wondering, like, as right now, like in undergrad, would I be better off doing more like research in undergrad or doing more like shadowing?
Yeah, I'll echo the same thing. I think Megan hit the nail on the head. It might be cool to just hook up with someone who is doing your desired field and say, hey, listen, I got excited and I followed up on that. It kind of shows your persistence and your commitment to the field. And you'll end up getting some kind of shadowing hours as well in that field too.
Thank you.
There's a question in the chat that I don't think anyone touched on, that from Sonia. If you know what specialty you're interested in, should you talk about it in the interview? Did anyone talk about that? Did I miss it?
I'd say if there's something in particular you really like, I would talk about it, you know. I would say, you should be open to new experiences when you make it to med school. There's going to be a lot of new stuff, and I'd probably kind of like temper anything you say, like, oh, this is what I really like doing. I got into this because of this and this, and I've been looking at it for years, and I think it's really cool. But I know there's going to be a lot of things that I see in med school. I'm open to looking at new things, but this is what brought me to med school. This is why I'm interested. Once again, it just shows what you're interested in, and why you're there. And I think that if you have a reason that you're really excited about something, I think that comes across very, very positively during an interview.
I definitely agree with that. When I was interviewing for med school, I knew I wanted to be a psychiatrist, and that hasn't changed for me. Like, all my research was in psychiatry, most of my shadowing experiences were in that field. So I had a reason why I really liked it. And I could talk about, okay, I've had these experiences and it's only made me more excited about this field. But I'm also really excited to learn about the rest of medicine that I haven't been as exposed to. So yeah, it's great to talk about what you're passionate about. Like if you, Sasha, going back to you, if you are like, yeah, my background is in forensics and I would love to be a forensic pathologist and I've hooked up with these people and it was a great experience. Totally. It's where you kind of, where it raises a red flag for the interviewers is like, I only want to be a surgeon and I know that's what I'm cut out to do. And like just having that closed mind, but being passionate is great.
I think we've got a great panel here. I just want to add one quick little extra on there. I think if you're interested in certain parts of medicine, like for instance, some schools are placed large importance on rural medicine, or they like taking students, or they're kind of looking for students who want to serve in underserved areas. I think if that's your passion and you're truly genuinely interested in pursuing that as a field, definitely bring that out in an interview, especially in a school that's looking, or maybe even has a track specifically for that kind of a career field.
Great points. There's another question from Sonia a little bit further down. Any advice on the personal essay or the personal statement and how to describe the activities section? I think this is a really great question because the personal statement, at least for grad schools, what I went through, it's just, it's an open box. You can do whatever you want. And I have specific advice that I give for grad school, but I'd like to hear also what your suggestions are for med school. Stuff.
Yeah, that's a really tough one. I feel like that's a really wide variety of things you can talk about. I know mine was about putting a trash can in the middle of the road and watching cars swerve around it. And on the interview, when the interviewer brought that up, in my head, I was like, oh my God, I can't believe I wrote about that. Like, well, so mine was really random. I guess the biggest tip I'd have would be to get it looked at and reviewed by someone who you trust. Like, I think I went to my professor who was teaching, the class was like science, technology, and society or something. It was really kind of like a thesis writing class, but I brought it to her and I brought it to a neighbor who writes children's books. And they both, they didn't really, they didn't like change the whole thing as far as like where it was going or like really make any big changes. But they helped me a lot with my, cutting out extra words that, don't need to be there, and like little things like that, just to kind of like make it flow better. So if you can get it like looked over and make sure everything is grammatically and, spelled correctly, that's important.
I'm sorry to interrupt you. I'm just dying to know, Bobby, was there a meaning to the garbage can in the street thing, or was that just?
Yeah, it was, I put a garbage can in the middle of the road one day. I think it was like we were like raking leaves or something, and I put a garbage can in the middle of the road and left it there accidentally. I didn't leave it there just to annoy people, but yeah, then I was sitting inside and watching cars kind of like swerve around it, like, and they all had to, like change their days and stuff around it. And basically I kind of used that to just like lead into how, I want to kind of be like the direct agent of change. Like I want to be, the kind of person that's, making a difference in people's lives. I want to be upfront. I want to be, right there kind of making those changes. And that's kind of like what I saw in the garbage cans. Like I put it there and I saw the effect of like what I did, and that was all the cars had to swerve around it. Yeah.
Bobby, that's great. That makes me think of like clinical pathway decisions.
Yeah, personal statements are tough, and they're very, very valuable part of your application. I think it's just time to shine, trying to show who you are. Like, Bobby really shined there and ended up working for him. I don't think there's really like a right or wrong way to do it, but definitely getting some good guidance and, run it by a couple people and your pre-med, advisor if possible too. But that's all I'll say about that. On the topic of the activities, I think there's another time to really shine and show that you can you reflect on what you did. You'll be a better med student or a future doctor because of it. And I think if you kind of keep that in mind, keep the, a solid reflection and also like a next step kind of value to it, I think that should also be a good recipe for success for the activity section too. Again, I haven't touched a med school application in, what was it, 3 or 4 years now? So, but that's at least how it was back then.
Just another like quick little note about your interviewing. Before your interview day, I would just, look over your resume and just remember what you have written down on there. Because I remember, getting asked a couple of times about things that I'd put on my resume. And I mean, they were like, I did those things, and like, it's not like I was like making anything up, but I had to go think back like 5 years, and I was like, oh yeah, like that. Like I totally need to like think about what I did there. So just like know what the interviewers are looking at.
I'm not a med student, of course, but this is the piece of advice that I give for writing personal statements, and I would think it's applicable here as well, is when you're submitting your application to graduate school, medical school, and they're looking at your resume or your CV, your application, you might have a line on there that says something about a shadowing experience. And to them, they read that one line and that's all they know about it. But your personal statement is a great opportunity for you to expand about specific experiences you've had or things that might contribute to your application and strengthen it that they can't detect just by looking at your application. So use it to talk about those, if you were sitting down and you had like one opportunity to talk about something that might impress them, don't try and be too like impress them, but something that's relevant that might make them more likely to accept you to their program.
I think we talked a lot about research and activities too. And if you do research or if you do shadowing, brush up on that research, kind of remember what you did the shadowing, just to echo all these points. It's like you should be ready to give the spiel, if you will.
There was a question that was addressed, Jenna addressed it in the chat. Was the expensive med school tuition ever something that was greatly discouraging? I think, as an outsider to med school, I think the tuition cost is something that a lot of people consider. So any thoughts or comments on that? Megan, this could be a good opportunity to talk about MD, PhD as well.
I mean, I'll always plug it. Yeah, so the MD, PhD program is fully paid for. Your tuition is paid for, and you get a living stipend for each year of the program. So for those of you who might be considering both med school, for those of you, here's the people who should go into MD, PhD program, I guess. It's people who know they want to go to med school and know they want to work with patients, but also really enjoy research and know that that's something that you want to be part of your future career. So it shouldn't be, I don't know if I want to go to med school or grad school, so I'm going to do this long combined program. It should be, you want both parts in your career. But with that said, if that is you, it's nice because when you're accepted to this program, it's more accelerated than just a PhD alone. So instead of the PhD taking 5 to 7 years, it usually takes 3 to 5 years. And like I said, throughout time, you don't have any debt as opposed to normal med school because it is either government funded or school funded. So they're kind of investing in you, which is nice.
While we're on the topic, a question just came through. If MD, PhD is paid for and has stipends, why don't more people do it? I think I know the answer to this.
I've been in Buffalo for 4 years and I still have like another 4 years to go. So I started when I was 22 and I will finish when I'm 30. So it is a little bit daunting when you think about it that way, but you're still living your life throughout that time. So for those people who want to go to med school are probably the people who are okay with being patient, but you got to be extra patient. And also the other grad students in this group can tell you that getting a PhD is not just a cakewalk either. So it's 2 very difficult doctoral programs that you have to put a lot of time and energy into.
Vince, this is a question for you. How's it been staying in Buffalo this whole time? So I'm in Canisius right now, but I really want to get out of Buffalo for grad school. Has it been all right just being in Buffalo the whole time?
Did you say you're at Canisius now? Oh, awesome. Yeah. So I was at Canisius, went to UB. It's a totally different feel. I think that if you really are interested in leaving the great city of Buffalo after med school, there's always, you're going to go likely for more training and residency. You can always do a residency outside of Buffalo and even a fellowship outside of Buffalo and practice outside of Buffalo. But I think a lot of people who choose to stay in Buffalo are really drawn to stay in Buffalo, and they kind of want to stay here for residency too, and maybe they set up shop here as a physician here. But I think as someone who's been in here the whole time, I think it's a bias, of course, but I think it's been a good experience.
There's a question in the chat from Veronica Johnson that I don't know if anyone replied to. Her question is pretty specific, but I think it can also be applied generally to people who change into medicine. The question says, since we are talking about volunteering / shadowing, I have a quick question. I'm a career changer. I graduated with finance. I'm doing my prereqs after work. So should I wait on my application until I get medical volunteering or research experience? What do you think? The volunteering I have is more finance related. So you can answer Veronica's question, but also this is, applicable to those outside of medicine transitioning in. And maybe I can simplify it a little bit to, if I don't have experience in medicine, but I want to do medicine, do I need experience in medicine before I start?
I think yes. I mean, it doesn't need to be everything. Like we talked about before, all your volunteering doesn't have to be in medicine, but you definitely need some shadowing or some clinical experience. Like I think Vincent talked about being an AMT, something in the clinical field to show, okay, I know a little bit about what I'm getting into and why I want to pursue this field. If you come in with no clinical experience at all, then I don't think most schools will really consider you, honestly, but it can be, like I said before, like 50 hours of shadowing is a good benchmark to get to. So if you can spend, I don't know, what is that, like 7 different days or something over the next months, that would be a good opportunity. And especially if it's with the same physician, like if you can have a good rapport with one physician and shadow them a few times, that would be really helpful.
Yeah, I think it looks a little like if I was looking at a resume and I saw someone switching in, they're like, oh, I want to be a doctor, but I've never done anything at all that like that is any kind of like clinical, any kind of thing. Like I'd be like, like what is it that makes this person want to jump over? But yeah, it doesn't necessarily have to be in a hospital or anything. Like I did a little bit of stuff in a hospital. I also worked with SABA, which is like skating with children that have like disabilities and stuff. So really it's experiences working with people really, and that can be a little bit looser than just has this person been in a hospital. But I would definitely recommend getting a little bit of experience before applying, just so that and even just kind of for yourself, you might go and volunteer at a hospital and think that this is the worst place in the world, and decide you might want to stay in finance. I don't think that'll happen, but you never know, and it's good to get just a little taste of what's to come.
Just answering specifically, should you wait on the medical application, or should you wait for research in general or volunteer in general? I think the sooner the better in terms of getting exposed, for sure. Oh, also too, when we're talking about the MD PhDs so graciously paying for your tuition and the tuition burden, I think it's been covered quite well. But another option we didn't really talk about is the military will also pay for your medical school. There's some programs there that you can decide to go to any med school you'd like, and you pay back, I think it's the amount of years that you're in med school. There's also a specific military medical school in Bethesda, I believe. And that has a little bit of a longer repayment, but also they completely pay for your school and also have a stipend associated with that too. So it's not, you don't have to do the MD PhD to get your free tuition, but I think everything comes with a little bit of a pros and cons list.
On that as well, there's several residency programs that will pay part of your tuition back if you commit to them Same with rural. If you're interested in working in rural towns, there's a lot of loan forgiveness programs if you're interested in working in a rural area. And I think Buffalo actually does qualify as a rural town, or at least the towns near here. So yeah, debt is such a serious topic and it really can feel paralyzing. So these are very serious questions, but you know, it's important to consider all of the options, and there may be one that you think is appropriate for you.
I have a question that might be stupid, but I think maybe at some point students applying for med school will face this question. What is there like a depth or like a threshold where something you've done belongs or doesn't belong on your resume, on your CV? You know, I think I've personally faced this where I'm like, I go through my CV every once in a while and I take things off. Like that's no longer relevant enough. But I know this is a really arbitrary question and probably challenging to answer, but would you recommend, I guess, keeping as many things on or removing things and keeping it specific to your application?
So for med school applications, it's very structured. Like you can only put in, I think, like 10 experiences. So you have to choose those 10 experiences that are most meaningful from your everything, like going from high school through undergrad and post undergrad if you take any gap years. So I think keeping a list so that you have it. I mean, it's always good to have a resume or a CV because you might be asked for it for other reasons. But yeah, it's you have to choose, I think, like the top 10, and then you write about them and why they were meaningful to you. So it's a little bit different, I think, than grad school in that way then. But that is something that you might not know before you apply to med school. So it is helpful to keep in mind. But always keep a list of everything you do because you will forget.
I think you want to keep on there the things that, you know, you either invested a lot of time in or that meant a lot to you for some reason. You want to keep on the things that you would love to talk about in an interview. If I've done like, you know, 40 different things and, you know, 20 of them like don't mean much to me, and, you know, the interviewer asks me like, oh, what do you think about this? And I'd just be like, oh, well, I don't know. I spent 2 hours doing that one day and I thought it was good for the resume. So I mean, I would, if it means something to you, if you want to talk about it, if it's something that you spend a lot of time on, I think it's good to have on. But I, you know, if it's something that was, you know, barely anything, I would get rid of it because I wouldn't, you know, I wouldn't want to talk about it during an interview. And I think I think you want to keep the things on that really kind of mean a lot to you.
I really like this question. What were your favorite and least favorite clinical rotations? And I'll tack on an additional question to this. Do you have any suggestions for, I don't know if you choose clinical rotations or if they're assigned to you, but if you choose them, I guess, any suggestions for that?
So for clinical rotations, we're all really not that far into them because we're third years, and only the last third and fourth year are clinical rotations. But all of your third year, you pretty much, everyone does OB-GYN, they do family medicine, they do internal medicine, psychiatry, pediatrics, and surgery rotations. So that's all of us right now that are third years are in the middle of those kind of rotations. And then you also get like 2 electives. I've done one. I've done radiation oncology. So like for me, I've really only done internal medicine, radiation oncology, pediatrics, and OB-GYN. So it's I mean, like for me, it's a little hard to say, but I guess just like with this question, keep in mind a lot of us still haven't seen everything yet. I personally, I think my favorite so far has been, it's funny because like pieces of the pediatrics, like I love that. And like, you know, you have certain days on the internal medicine where I love that. And I think the absolute coolest thing I've done in medical school and might ever do is like deliver a baby in OB-GYN. So I don't know. It's my least favorite things are like specific like days and times. I don't want to say that any of them are particularly bad, because some of them have really cool parts and some really not cool parts.
Join the liking the peds train. I really did like the peds rotation. I like neuro too. Neuro was an elective the way we run it here. But yeah, we've only done one out of the 4 semesters in the clinical year. So, and then also I kind of to tie that in there, we have Jessica Silvestri potentially in here. She's another UB Med student. She's a 3rd year as well with us. And I bring her up to introduce her, of course. She's also not a non-Buffalonian. She's from Long Island. Went to school in Quinnipiac for her undergrad. And she is a 3rd year with us. And she, kind of to answer Ayrton's question about changing the area that you're pursuing in the beginning and then started another, is it hard to do that? Any experience? And I think she should be logging in shortly. She had another appointment now, but she can speak this more maybe privately or when she does join us. She came to med school maybe like a plastic surgery kind of a field, and then fell in love with interventional cardiology when she did her cardiology rotation, and then she did OB, and now she's super interested in OB. And specifically oncology fertility, oncofertility, excuse me, if I'm saying that right. So that's basically taking folks who are our age, who are in reproductive age and unfortunately going through cancer, and making sure they preserve the ability to still have children later on in life. And so I think just your exposure, the rotations that we go through are super critical to our future career fields, future career path. Come on, Jenna, what's your favorite and least favorite section?
Ooh. Well, I was one of the people that came to medicine knowing what I wanted to do. I was very interested in dermatology ever since I was in high school, and that's just stayed true and true. I spent both of my electives so far in derm research and then derm clinical. So I had internal medicine first, and then I had 10 weeks of internal medicine followed by 10 weeks of surgery. And wow, I mean, it's incredible. You don't know what you're going to see in the hospitals until you're there. And, it's hard to describe it, but I think if you're interested in medicine and you have an open mind, every day is so much fun, and you're exhausted and it's time consuming and it can be a little scary because you don't know exactly what your role is as a medical student, but it is so much fun, and I just can't say enough good things about it.
Yeah, I think Jenna's experience illustrates that when you find something that you love to do, work can be awesome. And I think, I don't know, again, I'm not a med student, but finding that niche of medicine is very important, that the one that suits you, just like finding that niche in any career, including science. Not to make this about science, sorry. So anyhow, are there any other questions? We've reached the 7:30 mark. So theoretically, this event should be concluding. I'll give a second here for anyone else to add their questions into the chat if they have them, or to speak them.
I just chatted with Jess. She unfortunately is running late and not going to make this cutoff. But if anybody does want to talk to her about coming in from Long Island or from out of state, I know Jenna can also talk to you about that too. But she'd love to talk to you guys about that, or OBGYN and kind of the in-betweens of choosing between your rotations, stuff like that. So
you can see there are some contact information being added into the chat from our panelists. All right. Well, if there are no other questions, there's Jess's contact information. If there are no other questions to our panelists, thank you very much. You are all very experienced, and your information is very full of wisdom. I really appreciate you all being here. Megan's laughing because I'm ridiculous. Anyhow, yeah, thank you guys all. Really appreciate it. I hope this was helpful for everyone if you have questions still, please contact them directly. If you have questions that, if you don't get their contact information, you can always message the Aspiring Scientist Coalition on Instagram or email, whatever, we can forward it along. So thanks again for coming, and we'll see you at the next meeting.